All right, looks like we have everyone. So hello, everyone. Thanks again for joining May's Black Alumni Connection series hosted by UGA's College of Public Health Alumni Board. We are so happy and so excited to have you here, along with our two special guests, Dr. Amber Berry and Dr. Caldwell. Before I get started, I definitely want to introduce them to you all so you are aware of their background, and then I will hand it over to them and we'll go ahead and get the conversation started. So first, I will introduce Dr. Berry. Dr. Amber Berry is a native of Valdosta, Georgia, and graduated from the University of Georgia in 2012 with a BS in Health Promotion and Behavior. Following undergrad, she went on to get her master's in medical science at the University of South Florida. She completed her medical training at the Medical College of Georgia at Augusta University in 2018, and then continued on to complete her residency training in pediatrics at Baylor College of Medicine and Texas Children's Hospital in Houston, Texas. Currently, Dr. Berry is completing her fellowship training in sports medicine with Northside Hospital in Atlanta, Georgia, and will join the group this fall as a primary care sports medicine physician. Throughout her career, Dr. Berry has been an advocate for underserved communities and children. She has a strong interest in care of children and athletes from marginalized groups, social determinants of health, health policy, childhood obesity, and increasing minority representation in medicine. With a particular interest in bridging the intersection between sports medicine and public health, she hopes to further her understanding of how to address complex social and health issues that can impact overall athletic performance. And that is Dr. Berry. Dr. Berry, if you just want to wave hello, I'll give you a chance to speak after I introduce Dr. Caldwell. All right, next up we have Dr. Caldwell. Dr. Ebony Caldwell is a native of Augusta, Georgia, and graduated from the University of Georgia with a dual BSHP, or Bachelor's of Science, Health Promotion, and Master's of Public Health and Health Promotion and Behavior in 2013. She then went on to complete her medical training at the Medical College of Georgia, UGA Medical Partnership in 2018. Dr. Caldwell is currently completing her psychiatric residency training at Howard University Hospital in Washington, D.C., where she serves as chief resident and is active in research, education, and recruitment endeavors. She will be beginning an Addiction Psychiatry Fellowship at Yale School of Medicine this upcoming summer. She serves both as a member and in leadership capacities in several national organizations, including the American Psychiatric Association and the American Academy of Addiction Psychiatry. She is a proud member of Delta Sigma Theta Sorority Inc. and continues to engage in community involvement, including faith leaders and individuals dealing with substance use disorders. She hopes to combine a career in medical education and policy work focusing on marginalized communities. And that is Dr. Caldwell. So I definitely want to give you both a chance to say hello to our audience. So if you'd like to unmute yourselves.
Hi, everybody. Super excited about this session. So looking forward to answering some questions and hopefully be able to give you guys some insight on our path to medicine and through public health.
All right, good evening, everybody. Like Dr. Berry said, I'm very happy to be here and excited to, spend some time and answer any questions you all have.
All right, thank you both. And the audience, I'm sure you all will have a lot of questions, so please feel free to put them in the chat. And we have Valerie who will be monitoring the chat for us. So let's go ahead and get started with the first question. So to kind of get the conversation flowing, what is your favorite UGA memory?
Does it matter who starts?
Whoever wants to start first.
I can start. This was a good little icebreaker question, but it was actually really hard because I've had just so many incredible memories of UGA, and this is actually my 10th year since I graduated. And so some things are a little bit blurry because it's been a while, but also some fun nights. But I have to say, one of my most favorite memories was actually my first night going out in Athens. So after a crazy move-in day, like I lived in Creswell freshman year, and we all decided that we wanted to go out. And so several other Black freshmen, we all kind of met up collectively at Creswell. And it was like a group of 30 to 40 of us who walked downtown from the freshman dorms, which was kind of crazy to think about in hindsight, but we had no idea. And we went out and it was just such an incredible night. I met so many incredible people who now are still some of my closest friends, some of my greatest friends. But it just kind of set the tone for my 4 years at UGA. I just was like, oh, this is going to be an amazing experience with amazing people. This is college life. It was just a good kickoff, a good kickstart. And so that's probably one of my most favorite memories from Georgia.
Awesome. Yes, the community feels that you get when you meet new people, and during freshman year, definitely a great memory. Dr. Caldwell, what about you?
So I think my favorite memory was the second year that I went to Georgia, Florida. So I like drove down with my two best friends. It was like a road trip. And so we like went to Frat Beach on that Friday, and, just kind of like it was like, downtown Athens, but on a beach. So it was just a lot of fun. And then I think that was the first year in like a long time that we actually beat Florida. So it was like good to actually win, because the team was a little bit of a struggle when we were in undergrad. It's not, we weren't national champions like we are now. But just like that whole trip was just a lot of fun.
Absolutely. Yes. I think I will definitely agree with you both, but I will add on, celebrating was also one of my favorite memories with UGA friends. And I see you both shaking your heads, so I think you know what celebrating is. Okay, great. But for those who don't know, celebrating is when we'd go out with friends after midnight to Snelling, the dining hall commons, and just hang out and eat good food. But thank you both for those responses. So I'll kind of jump in now to kind of get an understanding of how you became interested in your respective fields. So how did you become interested in public health and medicine? Because we usually see people either interested in public health or medicine, but not really the combination of both. So what led you here?
For me, medicine was always kind of in the cards. As early as I can remember, I've always wanted to be a doctor, and I don't have like a cute little cliche story of like, oh, I hurt myself in my pediatrician. I don't even remember who my pediatrician was growing up, honestly. And so, and I don't have any doctors in my family, but it was something that was always in my spirit. I have pictures when I was like 4 of me with like my little play stethoscope and like little mask and stuff, and putting Band-Aids on my teddy bear. So it's always been there to want to do medicine. And then when I was in high school, I shadowed one of my mentors who was also a Black woman. She was a pediatrician, and that kind of solidified things for me that I'm definitely going into medicine. I'm pretty sure I want to be a pediatrician. But in terms of public health, it was never something that was on my radar. When I started at Georgia, I actually was a bio major, but I did not like it. I was like, I take plant science. I don't care about this. Like, I want to do stuff with people and like learn anatomy and all these cool things. And so one of my friends who I had just met, she lived down the hall from me, but she ended up being one of my great friends. She was my roommate in medical school, and she's a dentist now. But she told me about health promotion and behavior because she kind of started out on that path. And so after she told me about the major, I did my research and looked into it. And I was like, this is something that I definitely can see myself doing. It gives me different avenues. Even if I choose not to do medicine, I can still have a pathway to help people and do things that are going to kind of affect change on a broader scale. And so it definitely helped me to look at medicine in a more holistic view. And so I'm glad I took that pathway to using public health instead of like biochem or genetics or whatever, biology, which, I mean, no knock to those sciences and they're relevant, but I felt like all the things that I've done since have, with my background in public health, it has really helped for sure. So.
Yeah, I'm like Dr. Berry. I always knew I wanted to be a doctor. I think my dad used to stand over my crib and like whisper it, maybe a little magic. So, all through, middle school, high school, always said I wanted to be a doctor. Me and Dr. Berry actually met before college in the same like pre-med summer program. And so that was where I was actually introduced to public health. I think we had we would have like lectures once a week. And one of them, someone came to actually talk to us about public health. And I was like, oh, that actually sounds like what I am interested in. How can we affect change before people get sick, and, make our population healthier, and at a systems level, and, impact our communities. And so literally, I think during orientation, I changed my major to health promotion and behavior, because at that time, those are the only two degree programs, health promotion and environmental health. And I was like, I'm a little squeamish. I don't think that's for me. So I went ahead and, switched to health promotion and behavior. And I think it definitely has helped a lot.
Absolutely. Thank you both. And yes, fun fact, Dr. Berry and Dr. Caldwell are actually in the same class. They graduated from the same class in MCG. And that's something that I had no knowledge of until I met both of them. So really cool that they're both classmates and can kind of share their different paths after medical school. So thank you both for that. Can you walk us through the progression of your career from UGA to your current career as a physician?
Yeah, so I graduated from Georgia in 2012. Prior to that, I had already decided that I didn't want to go directly into medical school. I didn't feel like I was ready. So I didn't even bother applying. I knew that was what I wanted to do eventually, but I wanted to get my science GPA up a little bit and just get a little bit just more experience and feel more comfortable with my study habits and everything before jumping straight into medical school. And so that's just some self-reflection, self-assessment type stuff, because I think I would not have performed well, or I might have gotten rejected had I tried to do it at that time. And so I ended up applying to a post-bac program that allowed me to actually get a degree instead of just a certificate. And so that was a program at the University of South Florida. And I got a master's in medical science. And it was essentially kind of like fast forwarding through medical school, like the key points, and all of the faculty that taught us were the same faculty that taught the medical students. And I also got to do research during that time. I did research at the Cancer Center. It was more population-based research, kind of community, looking at women with breast cancer and like outcomes and stuff. And so I had opportunity to do that, and also had opportunity to shadow. And so that all was kind of to boost my resume to prepare me for medical school. And then after that, I took a year off. And so I essentially took 2 years off before starting medical school. So in my gap year, I ended up working at a pharmacy back home. And it was a compounding pharmacy where we made drugs, which was really cool. And I think kind of gave me a slight advantage and just something to talk about on interviews. And so I worked there for a year while I was applying for medical school. Ended up getting into my top choice, which was the Medical College of Georgia. I had ties with that, like Ebony said, we met at a program prior to college, which was at the Medical College of Georgia. And so I kind of had always wanted to go there for medical school. And so ended up going to MCG in Augusta, and was there for 2 years on the Augusta campus. And then there's regional campuses that MCG has as well. And then I did my last 2 years at our Savannah campus, which was awesome. And the reason I chose to do that was because it was going to be unopposed third year. And when I say that, there's no residents, there's no other like medical students who you're trying to compete with time to see or do. It's just you and you're attending. And so that gave me kind of a just completely unfiltered look at each specialty, so I could make the best choice in terms of what I wanted to ultimately specialize in. So for example, I was in Vidalia, Georgia for OB, delivered over like 30, 35 babies by myself with surgery. I was in Brunswick with just the surgeon, and I would close almost every case. And so I got a lot of good hands-on experience that I felt, like I said, gave me a really accurate view of each specialty. So I was able to choose, but of course I chose peds because I love kids. And so I chose pediatrics. And then after finishing medical school, ended up matching at my top choice, which was Baylor College of Medicine in Houston, which is an amazing program. It's the largest pediatric program in the nation. And I did my training at Texas Children's Hospital, which was amazing. And a fun fact about my program was with Baylor, it's a huge program. There's several different programs within the program. And so I matched into a specific program called LEAD, which stands for Leaders Evaluating and Addressing Disparities, which has kind of a public health focus. And so outside of just our general like pediatric training. We also got kind of specialized training in advocacy, in community health, in health policy, all of these different things that I could pull from because I had experience being a public health major and just to build upon. So it was amazing. Like, I love my 3 years of residency. It was hard for sure, but well worth it. And I felt very well prepared kind of exiting out. And now in fellowship, I chose to do sports medicine because I was always kind of been interested in sports medicine. I love sports. We went to Georgia. I'm from Valdosta, it's football country. I have a huge respect for athletes. And so to be able to take care of them, now I'm very excited about it, and still to be able to apply some of that public health knowledge and kind of all the things that I've gained, I'm really looking forward to as I wrap up next month with fellowship and transition into starting my first real job. So it's exciting. It's been a long road for sure, but very well worth it because this has always been, like I said, in my spirit that I wanted to do this.
Absolutely. And early congratulations to you. That is definitely very excited. A very, very long road ahead, but definitely excited for this new opportunity for you. Dr. Caldwell.
Sure. So I graduated in 2013 from UGA because I did the 5-year combined bachelor's and master's program and went directly into medical school. So I chose the Athens 4-year campus of MCG just because I really wanted that kind of a smaller class size, and the Athens curriculum was more so case-based learning and team-based learning. So we didn't have very many lectures. We actually did most of our learning in small groups. And so I knew that I learned best by having that type of interaction. So I decided to be in Athens. And I really enjoyed it. Just like Dr. Berry mentioned, like with the rotations at the Savannah campus, a lot of times you were just you and the attending on rotation. So you really got to, get a really in-depth experience, but we also did, some rotations in Augusta. So you also got to see, what is like in academic medicine. And so I, through my rotations, I kind of was between psychiatry and family medicine. And so when I was kind of making my decision, I realized what I actually liked about family medicine was really just getting to know my patients very well, like learning about their families and where they're going from and like how their life impacts their health. So I was like, oh, well, psychiatry, I did that all day. I just talked and I just listened to people. And so that's where I chose psychiatry. And my partner is from the DMV area. And so I applied to Howard University Hospital, which is where I am now. And what kind of drew me to Howard was it is an HBCU, and that wasn't an experience that I had before. Going to UGA and then UGA and MCG for medical school. That's always something I wanted to experience. And then also leaning from my public health background, I've always had the interest in serving underserved communities. And that's the, largest mantra of my institution. We're a safety net hospital in DC. We take patients that no one else will take. And we treat a predominantly Black and brown patient population. And that was something that was important to me for my training. And so since I've been here, I've kind of fallen in love again with addiction psychiatry. So, treating people with substance use disorders. I apologize if y'all hear my puppy barking in the background. I actually continued my experience from my public health internship. So I did a faith-based coalition with the Atlanta Public Health Department. And now I actually run a opioid education and Narcan training for faith communities here in DC. So, a lot of those systems and, community education, and that has definitely helped me to shape the career that I'm heading into now. And so that's, again, why I chose to go to Yale for fellowship, because I'm on their HRSA track. And so my primary placement will actually be in a community mental health clinic. So I'll mostly be seeing underserved patients with both psychiatric and substance use disorder.
Awesome. Thank you so much, Dr. Caldwell. It's like I said before, it's really interesting to see how both of your paths have, kind of started in the same spot, but then are branching out into just something different to make a different impact on the community. So thank you for sharing that. Kind of touching on your UGA aspect and maybe externally during your part or time at UGA, what were some of the resources or skills that were most helpful to you during the time while you were an undergraduate student or even in grad school or medical school, whether it be through UGA or externally?
I would say, there's two, I think, that kind of stand out. And one is from my master's program. It's like when everything finally clicked on how to study, and it just made things just so much easier, because at UGA, it was a struggle. Like, I mean, I did well, well enough to get through, but organic chemistry and physics and all that was kicking my behind. And I just didn't have a good, I was used to cramming and procrastinating and still doing well. I did that all through high school, graduated with honors, no problem. Thought I could come to college and do the same thing. No, ma'am. And so it wasn't until my master's that I really learned how to study, and it made medical school just so much easier. And also having people, studying with people who study like you. I used to in college just, I would stay with my friends, but we all have different study styles, and that doesn't work. You have to stay with people who, study the same way you do, especially when you're starting to consume large volumes of content and stuff. You have to have a good study kind of regimen. So that's one thing. And then just thinking about my experience with community health and planning, Dr. Hine and Dr. Cotton's class that I took in my major once I got during junior and senior year, those definitely kind of helped to set the tone for some of the things that I did in residency, whether it's, making plans for certain programs or, working with certain community organizations and knowing how to find my stakeholders or, all these different things. I had a good foundation from those classes that I took at UGA. So that definitely helped to kind of set the stage to continue to build upon.
Awesome. Yes, our professors and anyone at UGA was definitely very helpful when it came to that. And I definitely agree. Having a group of friends who have the same study habits as you is definitely very helpful. I know for myself, I took organic chemistry too, and I'm not going to lie, that was a struggle.
A struggle.
Dr. Caldwell?
Yeah, so I would say definitely, even though it is literally makes my brain hurt every single time I have to deal with it, biostats has been so helpful because, you think, oh, I won't need this, but I use it all the time, either when I'm doing research. In medical school, I was on a project and I had to literally do all of my own logistic regressions. And I was like, well, I guess I actually do have this skill set and I can actually do this, but I don't want to, but, it's not something foreign to me. And where we're, assessing literature so that we can have evidence-based decisions, having that background definitely helps a lot. And I would definitely say another skill that I think I really honed at UGA was, the importance of mentorship and just networking. So I was able to find my research person that I worked under when I was at UGA just by reaching out to whoever I thought was interesting. And I was just, I was a sophomore and I was like, I don't know anything about research, but what you do sounds cool. And someone told me I need to do this for medical school, so I might as well enjoy the process. And I've kind of just continued that type of trajectory. I will email anybody anywhere about something I'm interested in. I have no problem walking up to people at conferences just to introduce myself. I will even call people if somehow I can get their numbers, their office numbers, or, it's from a close associate, their cell phone numbers, because that's how you can really shape the career that you want in medicine, especially being a Black woman. We need all the support that we can get. And there are, definitely people who will, lift you up and mention your names and, the right places, but only if you are interacting with them.
Absolutely. I definitely agree with you. Reaching out to people, cold emailing sometimes ends up becoming some of the most great relationships that you have and help you lead the path kind of where you want to see yourself. And I definitely agree with biostat. It's funny because a lot of classes that I did through during my master's, everybody would always be curious, like, how are we going to use biostat? I'm going into, health policy and management. How am I going to use biostat? But now at the CDC and also hearing from you all, it just shows how important every part of every subject that we've taken in during our master's program or even during our bachelor's that we did in public health. Thank you both for those. So one question, I know we kind of touched on it. How did obtaining a bachelor's or master's degree in public health help you advance your career in medicine? And I know we're still in the middle of a pandemic. So if you want to touch on that too, that would be great. But just an overview of that.
I think for me, it's had a huge impact. I think just in general, how I look at things when I approach issues with my patients, I don't look at them as just an individual. I look at things from a system-wide view. Most of the problems that affect, especially like when you're talking about kids and like underserved kids and stuff, it's bigger than them. It's something that has been ingrained and instilled, is institutionalized. Like it's part of the framework of our country and kind of what things were intended to be, but it's barriers that need to be broke down. It's systems that have failed or whatever. And so I look at things kind of from more of a system-wide perspective, and just kind of the different levels. I think about like the little public health pyramid with all the different parts and stuff and how you can implement change and how you can implement treatment programs and stuff. And so I try to think about things on how I can hit each of those. And if I can hit them from the bigger pool and have a bigger impact, great. But sometimes even the smallest little thing from the individual level can also make a huge impact. And then the other thing when kind of thinking about how I want to, as I enter into sports medicine, kind of transitioning from pediatrics, first off, I never thought I was going to do like complete like solo sports medicine. Ideally, my ideal career is to do kind of a hybrid of general peds and sports medicine, but starting off early career, I'm definitely open and will be doing just 100% sports medicine. But thinking about how I want to approach that, when you think about athletes, and a lot of the athletes we treat, they come from disadvantaged backgrounds, they come from marginalized backgrounds. A good majority are minorities, but when you think about sports medicine, is musculoskeletal injuries and stuff, but there's more, kind of what you said in my bio, that contributes to their overall athletic performance. And I think public health can play a huge role in that, and just kind of finding that intersection of sports medicine and public health, and kind of truly understanding some of the system-wide issues that can impact athletes and impact communities and ultimately, affect their performance. And so that's kind of how I want to approach things. I haven't completely figured out how to do that yet. I have some ideas, but as I get into my career, I have some very supportive people around me and like colleagues who are on board, and Northside has been super supportive. So I'm excited to kind of dive into that and kind of see what things I can shake up and what changes I can kind of help implement.
And we're excited to see it. Keep us updated on all that you do, Dr. Berry.
For sure.
So yes, I would definitely echo Dr. Berry, just in how I approach patients and patient care and issues. I think I definitely notice, amongst my other colleagues who don't have that public health background, I'm definitely looking at that whole, holistic view. And I feel like my public health background is what actually pushed me into psychiatry, because during my rotations, I feel like that it was the one rotation where we actually looked at the whole person, and we learned about things like social determinants of health and how systems impact people's access, and how they're able to engage with the medical system and different things like that. So I was like, oh well, psychiatry is definitely the place where I want to be, because this is every time you do a biopsychosocial social assessment, you're going to touch on all of these things. Whereas in some other places, I feel like sometimes, it's an added, like, oh, well, let me remember to do this, but you can't do that in psychiatry. The person is a part of their system. And I think that having a public health background has also helped me a lot in leadership capacities, because, I have been out in the community. I have worked with, lay people who have no medical background whatsoever, who do not speak medical lingo. And so, I'm aware of things like health literacy and how can I communicate, this complicated, all this medical jargon and these biostats and what does all this stuff mean in a way that's digestible so that they can actually do what they want to do. And so I think because I can kind of navigate between those different domains, it's allowed me to, say, oh, I want to be in charge of this, or I want to start this, and I'm able to actually successfully do it. And I think it really helped me to develop my love of like education. So, being forced to, do the different projects and, the posters and the presentations, and, talking to different people, I learned that, I actually enjoy, the education part. And so it helped prepare me for when I became the resident. And so now I'm the teacher mostly for the medical students. So, how can I break down again all these complicated and all these acronyms, all these different systems in a way that they can understand. And then the same thing for my patients.
Absolutely. Thank you for sharing that, Dr. Caldwell. I think it's very important to be able to translate that information, the medical jargon, into kind of the level that the community can understand it. I know the work that I do at the CDC is majority focused on that, translating COVID information into something that the population can understand. So can't emphasize that enough. Thank you both for sharing that. On to our next question. Since May is National Physical Activity and Mental Health Month, what advice about mental health, and Dr. Caldwell, that's your field, and physical activity, Dr. Berry, can you share with students, colleagues, and other alumni on this call today? And if you have a combination of advice to give, that open to hearing that as well.
Yeah, so I think mine is kind of a combination. So the advice that I would give is to always prioritize your mental health. I think that especially after we're still in the pandemic, but in the midst of the pandemic, I have seen just huge spikes of just suicidality, suicide attempts, depression, anxiety, like with my patients, like as young as 8 years old with suicide attempts. And it's just like, you haven't even like lived life, and like what can be so bad, but it's a real issue. And even like amongst my colleagues, and just how many people are just so burnt out and just ready to quit or ready to walk away, or like, I made the wrong choice, I should have chosen another path. And with medicine, you would think like, oh, medicine, you work in medicine, that should be a huge priority, but it's not. Medicine they're getting better, but it can be a very toxic culture. And so I think it has to, like when we started, and Ebony, you can echo me if this is true, I felt like wellness was like a trendy topic, and like, oh, let's do some deep breathing, let's do some, we'll have them bring around the therapy dogs or whatever, stuff like that it's nice, but it's not getting to the root of the issue. And I think kind of on the other side of 2020 and all the things that happened between the pandemic, the racial uprising, like all these things that kind of just shook people to their core, there's been a shift and a recognition that there's a huge need for more resources for people, for providers, for patients, just kind of everybody across the board, and normalizing it too. It's okay if you need help, if you need to talk to someone, if you need medication, whatever. So I think prioritizing it and also normalizing it. And then in terms of physical activity, that's always been for me one of my go-to kind of coping mechanisms, to be active, to get outside, to exercise, whatever. One of my big pandemic splurges was a bike, and it was just so peaceful for me to get out there. Houston has great biking trails and bayous and stepping sites to just ride my bike. I ride for like 20 miles, and it was just very freeing. But it's physical activity, you're clearing your head also, so it's good for your mental health. And there's science behind it in terms of releasing endorphins and Even when you think about athletes and how they use physical activity to have structure, to have a sense of community, all of those things kind of help their mental health and a sense of purpose as well. And so there's huge benefits to both, but biggest piece of advice is to prioritize it. It's okay.
Dr. Berry said everything that I was going to say. But yes, I will definitely agree. I think that wellness has definitely come more to the forefront, especially for, medical providers, since, our wellness was basically sacrificed to try to save people during the pandemic, just because we had no other choice. And it is very important to, prioritize your own mental health, because you can't pour from an empty cup. You're not going to be the best doctor just because you're always working. You're not going to be the best medical student because you're always studying. That's not how it works. And so, I think a lot of people, especially in medicine, who want to go into medicine, we're kind of, type A people. We're always used to always being at the top of our game. We're always used to being go, go, go. But, it's okay to, need help. It's okay to need to take a day off. Like I tell my residents all the time, look, you get 13 sick days a year. You should take them. Like, take them, call out. We'll be all right. The patients will be all right. We'll figure it out. Like, if you could give us at least a day, that's great. But if you wake up and you're literally like, if I go to work today, it's not going to be beneficial to anybody, then just call, don't go. And you can do that for medical school. You do that for undergrad. Like, you have to take care of yourself. And like Dr. Berry was saying, that, mental health and physical activity, kind of go hand in hand. And, that doesn't mean like I cannot even ride a bike. So I will not be biking 20 miles anywhere. But, one thing that I picked up in the pandemic, me and my partner purchased a home, was gardening. Like every working virtual, I work basically from home for most of my third year, doing outpatient, and almost every lunch break, I was out in my garden, planting stuff, weeding, watering. I had no idea what I was doing. I was like, I'm gonna just try this out. But, it got me out of the house. It got me active. And so I think a lot of times when people think of physical activity, they're always like, oh, I need to go to the gym, or, oh, I need to work out for 2 hours. Physical activity can be a lot of different things. It can be, going to garden. It can be parking your car at the back of the parking lot to walk, get a few extra steps, skipping the elevator and taking a flight of steps. So, it's a way that you can incorporate it. And, I'm also someone who lives with disabilities. So I know that, I have to listen to my body. So sometimes I want to go out to the pool and like, girl, sit down. And so my activity for the day might just be some gentle stretching. So you also have to, just like you listen to your body about your mental health, you also have to listen to your body about your physical health, because a lot of people did turn to physical activity during the pandemic, but we've also see people kind of pathologize physical activity, where it's like, no, sweetheart, you need to go see a therapist. Like, you working out 4 hours a day and you are not an Olympic level athlete is not healthy, and it's not doing anything but breaking your body down. So, you can't sacrifice one for the other. They have to go hand in hand.
Absolutely. And I think that both of you have said such critical points. I mean, the pandemic has brought us into a new world per se. And so even physical activity, even for myself, it was hard to determine how I could be physically active, in quotations. And so, like you said, gardening, riding a bike, or anything, it doesn't have to mean, physical activity does not have to equal going to the gym. And so can't iterate that enough for myself. But thank you both for sharing that. On to the next question. I know we have a few minutes left, and I do have a few more questions that I want to ask, and then open it up to the audience. Knowing what you know now, what do you wish you knew when you were back in school? And this could be anything in general, whether it's education-wise, experience-wise, anything.
Mine is experience-wise. And I mean, I guess I kind of applied this, but it's okay to not have it all figured out. Like, I think I came into college and I used to make a plan. Like, I planned out my semester, like what I'm gonna take this semester, I'm gonna take the next, like everything was always planned. I'm type A for sure. But it's okay. It's okay to not have everything figured out. Take risk, make mistakes, take time off, whatever. Like my dad, I remember me and my dad got in the biggest argument when I told him I wasn't going straight into medical school and I was gonna do a post-bac. And then take another year off. He was like, "You're not gonna go back." No, I am. I have my plan, but I need to take some time for myself because I knew in order to be as success, like to give myself the optimal, path for success, I had to take that path. I couldn't go straight in. Otherwise, I don't think I would be where I am. And so you'll still get there eventually. Deferred does not mean denied. And so it's okay.
Yeah, I would definitely echo that. I too am a habitual over planner, but my plans definitely got disrupted in medical school. I ended up getting sick, very ill, and I had to take a medical leave of absence and repeat an entire year of medical school. So that was very hard for me because, it wasn't my plan. I was like, nope, you do your 4 years of medical school, you go to residency, and then you go be a real doctor. But my body was like, you think? So no, you're gonna sit down, you're gonna rest, you're gonna let your body heal, and then you can go back, but you have to do it differently. And so I think that was something I wish that, I had kind of recognized going into medical school, especially because, life happens. I had multiple of my fellow medical students who had medical things. I had a medical school friend who got diagnosed with MS. I had another one who, had sickle cell anemia and ended up having recurrent flare-ups all the time. I had another one who ended up having to quit medical school altogether just because, she was like, I'm either going to be a doctor or I'm going to have my health. And so, it's okay to have a plan, but it's also fine if your plan doesn't work because there's always something you can do. And definitely, having a public health background, there's so many different things that you can do with your degree and with your experience. And definitely after COVID, people are always looking for ways of how can I actually incorporate health into, my business. So, you can end up working for Tesla, you can end up working for Facebook, for Google, there's different ways to achieve. And there's also different paths. Like I know people who wanted to go into medicine. And so they decided to go to PA school. They went to NP school. They, became chiropractors. They went into mental health. So, it's okay to have a plan, but it's also okay to let life guide you to where it is. Because when I went into medical school, I said I was not going to do psychiatry. That was psychiatry, and I wasn't going to do surgery. I'm a whole psychiatrist. When I got to residency, I was like, oh, I'm not going to do child and adolescent, and I'm not doing addictions. I'm still not doing child and adolescents, but I'm doing addictions. So I've stopped saying what I'm not going to do because life seems to have a sense of humor. So also just be open to it, especially if you're going to medical school. Everyone kind of thinks, oh, I'm going to be fill in the blank, but you never know. You might hate fill in the blank. And, then you're going to be lost because you planned everything out about, oh, I'm going to be, I don't know, a neurosurgeon. But then you realize, actually, I don't want to give 7 years of my life to this and not sleep. So, it's okay to deviate from the path.
Absolutely. Both of you touched on such great, important things. And as a type A myself and someone who likes to plan for the future, hearing this definitely resonates with me. So thank you both. One question about yourselves. What accomplishment are you most proud of?
The fact that I'm almost finished. Like everything, this whole long path is about to come to an end in a new chapter, with my career and kind of how that will unfold is about to begin. But I just feel like people don't even know, people don't understand medicine. And they like, dang, you still in school? Dang, you still ain't finished? I hear that so much, but it's a long road. And I don't think people understand, after college, it's at least 8 years. And so it's a lot, but finishing, I think, is, yeah, super proud of that accomplishment. And funny story with my my fellowship graduation is actually next week, I think, on the 10th. And I kind of not really minimized it, but kind of minimized it. It's a small little ceremony we having. And I had sent the invitations to my family, but I was like, oh, y'all don't have to come up. It's not that big of a deal. And my mom was like, this is a huge deal, like all of your accomplishments, and especially this one, like you're finished. And it just made me kind of take a step back and realize, like, you're right, like this is an amazing, like major accomplishment. Like I've made it through all of my medical training, and it's something to celebrate. So very proud of that.
And we are very proud of you, Dr. Berry. We'll be cheering you on and clapping you on at your graduation.
Thank you.
I think what I'm most proud of is the fact that I've been able to actually thrive in residency. So I feel like in medical school, I was just literally in survivor mode. It's like, let me just get through this test. Let me get through this rotation. Let me get through this step exam. Like, you know, I might be hobbling to the finish line, but as long as I can get that MD and match, that's all that I really cared about. Whereas in residency, like I've been able to really, I think, flourish, you know, doing different things, being on committees, meeting literally the leaders in the field that I want to go into, and them knowing me on a first name basis. And, you know, having people come back to me like saying, oh, you know, you really shaped me. You convinced me to go into psychiatry, or, you know, having patients, you know, families saying, oh, you've taken care of my family member, you know, or you convinced me to take this medication and it just changed my life. So those type of things like make the struggle all worth it. And like, you know, working at Howard, like I said, we're a very under-resourced hospital. There is no endowment. Like when anything that's extra, we got to figure out how it's going to happen. And so it's an environment that, you know, can contribute to a lot of burnout. But, you know, somehow I've been able to come out of it. You know, I'm not jaded. You know, I'm still, you know, passionate about the work, passionate about serving this community. And to me, that's probably my biggest accomplishment.
Absolutely. Thank you both. And we're both so proud of you. I mean, having you both as the UGA alum, it just makes us even more, we're like, wow, these are the people who went through UGA and are doing such great things out there. So we're glad to have you here today. One last question before I transition it to the audience to ask any questions that they have. What advice do you have for graduating seniors as they prepare to transition into the real world? I know we touched on advice a little bit, but is there anything in specific that you have for them as seniors?
Just as you're entering out into the real world, a big piece that I have, and I think this is just with our society in general, comparison kills joy. So don't worry about what other people have going on. Like, don't try to keep up with this person beside you, or like, oh, they're already getting married, or oh, they have kids. Like, I'm just still here, or whatever. It could be money, whatever. Run your own race. Ride your own wave. Just, you'll get where you're going eventually, but just kind of try to stay in line with the goals you have for yourself, and don't try to pull from other people and compare yourself. So I think that's a big piece for sure.
Definitely. And I will also add, you know, a closed mouth doesn't get fed. So if there's something that you want, if there's something that you need, ask for it. Because the worst thing they're going to tell you is no, and then you still won't have it. So, you know, whether you're, you know, going into medicine and you need a mentor, you need a letter of recommendation, you want to shadow somebody, you know, just ask them. Or if, you know, you're not going into medicine, you're going into career field, you know, ask what you want to get paid. Ask for that leave time. Ask for accommodations. Ask for a flexible schedule. Like whatever it is that you need to achieve, you know, your goals and your wellness, ask for it. Because you are not going to get it if you don't.
I agree with that 100%. As somebody who just signed her first contract, ask. The worst they can say is no, but most of the time they have the money and the resources to give you what you want. So yes.
Awesome. Thank you both for sharing that advice. I know that's definitely helpful for me and plus on for for graduating seniors. Before I turn it over to the audience, I do want to give our president, Erica Parks, a chance to speak. Erica.
Thank you, Samarina. Thank you, Samarina. I want to know, is Susan here? Okay, then forget I said that. Thank you, ladies, for joining us tonight, and thank you all for being here. I am always taking a couple of notes, and there are a couple of things that I want to highlight you said that I heard. You didn't say this exactly, but this is what I heard. Resilience, listening to your body, pivoting, because there's always more than one path. That's the biggest takeaway I got. Personally, I can attest to what you just shared. But I also want to give a special shout out to my soror for being here, Dr. Caldwell. Did not know you're a member of Delta Sigma Theta. So I have to tell you, thank you for being here. And Dr. Berry, thank you so much for your openness and honesty about resilience, perseverance, and staying on the path. And I'm sure that came with a lot of sacrifices that you mentioned the years that you have been in medical school. Before I close us out, I want to know if there's anyone that has any burning questions before I close us out.
Erica, I think we had a question in the chat. Let me pull it up. Okay, so how do we as public healthcare practitioners put our mental health at the top of the list? We must lead by example. Any resources that you all have or any advice for that?
I mean, I would say definitely, prioritizing it. You need to be, you've heard the phrase pay yourself first. So, when you're scheduling your week, if you know that you need to have a therapy session every Tuesday at 11 a.m., then your calendar needs to be blocked every Tuesday at 11 a.m. because if you don't do it, no one will do it for you. And that way, I know typically in psychiatry, like, oh, you don't disclose anything about yourself. But I tell my patients, like, look, I've taken antidepressants, I've taken mood stabilizer, I've taken anti-anxiolytics, I have seen a therapist, I've been on their couch sometimes twice a week. So, I think modeling is a very important tool that we talk about in public health. So be the model that you want for your patients. So whatever that means for you, again, everyone is not into therapy, that's fine. If you want to do meditation, if your thing is exercise, if your thing is spirituality, it's whatever, but you have to take that time and prioritize your mental health, because if you don't, your physical body will follow down the trail of destruction.
Absolutely. Thanks for sharing that, Dr. Caldwell. Dr. Berry, do you have anything you'd like to add?
No, I was just going to agree with her sentiments, kind of back to what I said about prioritizing your mental health. And like she said, you can't pour from an empty cup. Speak up for yourself, advocate for yourself always, because nobody else is. And so that's kind of how we have to, like the person who asked the question, we have to lead by example. Unfortunately, we don't do that all the time, and we are often the worst patients when it comes to just even with mental health, physical health as well, making sure you're going to appointments, making sure you're getting checkups regularly, your screenings, all of those different things too, because that's equally as important. So take care of yourself. That's my advice.
And I will also add, just like, you have your primary care doctor, you have your dentist, so that you have those things in place before things go wrong. As soon as it's within your means, your availability, find a therapist. Even if everything in life is going great, that's not going to last. I think life is gonna life. So, find your therapist, what we call prophylactically, our primary prevention, so that, when life does happen, you're not also dealing with this new crisis and trying to find support, because, the waiting lists are long. The mental health providers are also, nearing burnout. So, the more that you can plan for when life happens, then the easier it will be for you to adjust and to survive through that.
Absolutely. Thank you both for sharing that. Erica, do you have anything else you'd like to add? I don't see anything else in the chat.
No, I'm going to close us out at this point. I think this is the best way we could end our series. We don't have a series throughout the summer. We're going on a sabbatical. Ladies, I am so appreciative of your time for being here with us to share Mental Health Month and also being the month for sports. What is it? Sports. I don't want to say it wrong. Say it, Samarina.
Yeah, physical activity, National Physical Activity.
Physical activity. In my mind, you have to exercise. You have to move your body. It helps your mental health. It helps boost your energy. It helps increase your mood. That's where your creativity comes from. And all of us are swamped with work all the time. So I would encourage you to take a day, one day a month, to plan for your mental health. I call it a mental health day. Nothing has to be wrong. It's like the doctors told us, be proactive. Take that day to decompress and de-stress your body. But before we go, I always like to have a call of action. And I would be remiss if I didn't take this moment in a full house to give a call of action to the 2005 Society that we just started here a couple of months ago at UGA. And this society is different from any of our other giving campaigns that you can give to. This one is special, and here's why. It is the birthing of the College of Public Health. The College of Public Health was established in 2005. This scholarship is for our student leaders, aspiring public health practitioners who may have challenges beyond academics. It may be challenges that they may need food, they may need to take care of their utilities or whatever it is, but it's a financial burden that they have. That can be a stumbling block. It can be a hindrance in their success. We don't want any of our students in the College of Public Health to be stopped in their academics because of any hindrances. So tonight, I'm going to encourage all 22 on this Zoom to give a minimum of $25 to the 2005 Society so that we can continue to sow seeds into our students, to invest in their education, and to remind them that there is someone always there that's rooting for them along the way. Thank you for your time tonight. Thank you for your dedication and loyalty to the College of Public Health. If there are any major donors here tonight, we thank you. You see that the work that you're doing through your giving and your time also, that we're using it wisely. Lindsay just shared in the chat box. I want you to take a moment to look there. The link to give to the 2005 Society. You can give $20.50 a month annually, every month. You can do that every year. Or you can give $250, you can give $2,050. Whatever it is that you're led to give, we ask you to give to the 2005 Society. So if you would take this moment and check the chat box so you can copy and paste that link. I hope that you have that. Make sure you use it. Go right on over when we end this Zoom and give to the 2005 Society. Thank you so much. Please stay close to your announcements, to our newsletter, and make sure you come back. Tell others about this series that we're doing. We'll start back up in August. I hope you all have a wonderful evening. And remember, it's Mental Health Month. Make sure you do something every day to take care of yourself. Good night.